Okay, so what we'll do is we'll start with question 1, and what I'm going to do is to invite our Spanish-speaking group. Is Eric here? I can't see whether Eric's on the screen or not, but I'm sure he'll be back in the room here somewhere. Eric, can you hear me if you're back in the main room? Oh, very good. Okay.
Yeah.
Eric, did you guys get through all 4 questions? Did you do them in order? Did you focus on one more than the other?
We did. We covered the 4 of them, and we were able to discuss all of them. So it was very good.
Oh, well done, you.
For the French, we did 3, almost 4. The 4th question we didn't have that much time to go in depth, but for the 3 others we had a strong discussion.
Okay. Oh, well done. So Eric, what I might, if you wouldn't mind, could you lead out and give us a summary of the discussion that you guys had in your group?
Sure. Starting with the first question, it was interesting how some country offices mention and some regions, right? Mostly trying to follow what the government or the authorities are recommending. Yes, and that's something that Corey also mentioned that is important. Of course, we have to follow that. But sometimes we are caught in the middle of, pressures, either pressures from the government to reopen so the economy is not so affected, or even from the donors that they want us to resume activities many times and fulfill, the timeframes that we have. And so those challenges are of course taken into consideration by country offices, but make our job a little difficult. And in the middle, of course, we have people that many times they don't feel comfortable in in going out and trying to work in an environment where they don't feel always safe. There are, of course, all the measures that we're taking, and that was part of question number 2. Do you want me to cover just the first question, or you want me to?
You can go ahead. You can go ahead on to question 2. And I was actually just thinking that the way that the staff feel and how vulnerable they feel is actually exactly what is covered in question 2 as well.
Exactly. Yes. So offices mentioned in question number 2 that yes, we are taking all the measures that we know of, and so we are. For example, Ecuador was mentioning that they are running public shelters for Venezuelan migrants and refugees. And so on the ground, they are disinfecting, taking, temperature of the people that are arriving, trying to promote and enforce the hand washing as frequent as possible, social distancing. They even have visits from public health to make sure that people do not show symptoms, and if they do, they even have a preventive space in their project where they will isolate a person that is showing some symptoms, so it doesn't have an impact on the rest of the people. And those are some of the measures that they're taking, and it was interesting that they were showing those on the ground. Sometimes we think of those measures more on our country offices, but this is on the ground, trying to maintain our activity on the ground and making sure that as much as possible we follow everything that we know of that can prevent people to getting infected. And then they are evaluating the conditions on a weekly basis, and in some cases on a daily basis, just to make sure that we are taking all the steps needed.
Is there any discussion in your group, Eric, about how that is done in a way that respects staff, done in a way that is not going to embarrass or make staff feel belittled?
There were not many mentions on that. In terms of staff, I actually tried to see what, try to push that discussion a little bit. they understand that the staff, it's important. And one of the things that they highlighted is trying to have a clear communication to them, something that Corey mentioned as well, so that staff knows. And one of the highlights that was made was that this crisis has actually, even though we are a little apart one from the other, we're actually close because we're using the communication tools that we have, and we're being more intentional in terms of the communication. So the staff are appreciating that. And if we continue to have, and they are being part, like some of the staff are being part of these committees that decide the next measures, and they can share their fears, and they see that these fears are addressed in a way to always make sure that our staff is protected. And they see that that is the best way probably to get the staff to feel safe and go about doing their job.
Yeah, cool. Thanks very much for that, Eric. I might actually give the opportunity to one of the other facilitators to perhaps share on some different questions, just in the interest of time.
Yep.
Reese, can I call on you? Did you and your group get through to cover any points that Eric hasn't so far covered?
Yeah, so we did for question 3, talking about the benefits of working remotely. So what people shared was that staff members were the ones who were working from home had a benefit to their mental health. It was less stressful being able to work in the comfort of their own home. However, there were also some challenges. Lack of reliable internet, making it a challenge to be able to work remotely. And we also talked about another challenge of if people are going to be working in the office, how do they work together when they can't be in the same space? So having Zoom phone calls, even when people are in the same building. There was also a benefit for staff, as working remotely has provided them an opportunity to learn more about technology and use those new technological tools. And so that's kind of what my group shared a little bit. Question 3.
Thanks for that, Reese. I guess I like the optimism in terms of having had the opportunity to learn about new technology. And I think in November last year, Zoom had something like 80 million users, and now it's something like 200 million users. So yeah, a lot of people, I'm sure, have had the opportunity to learn about new technology. Corey, have you got something additional that you would like to share from your group?
Yeah, thanks, Victoria. Look, we just got through every question. I think the key takeaway that we spoke about was remembering why we're doing all of this. As you're looking at government regulations, policy regulations, employment regulations, they're all a baseline. They're not always done in a way that's for the best health and well-being of your staff members. And we think particularly looking at the US, the issue of health has become quite a political issue, which is disappointing. And so it's important that country officers interpret that information, build relationships with staff, and make sure that any decisions that you're making are to the best benefit of your people. And so that point came through very clearly, particularly from the Africa region, where there's a crisis management committee for the regional office, and it's important that task force is operating with the purpose of why they're there, and the purpose is to keep their staff healthy and well, and to improve the well-being of their staff. So any decision that is made must be to that benefit. It's easy to get wrapped up in following regulations and guidelines and the amount of information that we're receiving. Just important for administration and country office leadership to interpret that but to make sure that any decisions that are made are actually to the health and well-being benefit of your people. So that was probably the main takeaway from our group.
Nice. So not getting wrapped up in guidelines and policies and putting people first. Rado, I'm interested to know what the French-speaking group was talking about.
Me?
Yeah, Rado.
Okay. Can you hear me?
I can hear you just fine.
Okay, so in the French group, we had a few discussion. Most of what we discussed have been already shared by the other groups. Maybe there was one specific issue that I want to raise here, is that we had two different vision, men and women, in terms of the teleworking, where the men seems to appreciate it very much, where the women were more considering the responsibility that they are taken in the household. They have to take care of the kids, prepare food. For men, it was less stressful to have the working, which was not the case for women. Regarding the measures that have been taken or should be taken in the country offices, there was one comment specifically that came from Madagascar, where the decision from the government depend on the region where you are. So the interconnection, the communication between the main office of ADRA and the regional offices should be avoided as much as possible, even if sometimes it's not possible. So we need to make sure that there is some measure taken for travelers from different regions, where different laws are applicable. Also, one of for both ADRA Madagascar and ADRA Congo that participate in the French group, one of the measures that have been taken when the office was open is to make sure that the staff that are in obligation to get into the office are using the ADRA's vehicle instead of the public transportation, to ensure that there is limited risk of contamination, and as the cars are disinfected. I believe these are the things that haven't been discussed by the other members.
Thanks very much for that, Rado. It's interesting to note the differences in how the working remotely or teleworking has affected men and women differently, or certainly how it's perceived different, and the different levels of stress associated with that. That's a really interesting point to bring out. Jason, can you hear me, Jason? We'd love to hear from
Sure.
room 2.
Yes, we were able to cover a number of the questions, and I think that some of the comments have already been reflected. Certainly that offices were doing their best and receiving communication typically from national authorities. There was official guidance, but in some cases offices actually preceded the official announcements, took preemptive action to make sure that people were protected while they're waiting for official guidance to come in. It sounds like the Asia Regional Office did a very good job at distributing guidance to people. We discussed a bit the effects of limited field travel on project implementation and how it's been a challenge in some cases, whereas Rado was saying that you have a central office, but you have activities in the field and staff can't necessarily circulate. I was impressed to hear the measures that offices that had taken. Of course, not everyone is equally affected, but the level of consideration given to staff to make sure that some employees who couldn't telework were still kept on the payroll Other considerations that were given to staff and flexibility with their schedule, including one office enabling their staff extra time to grow a garden because of the limitation in food supplies coming into the area around the office. And I think there's also a wide variety in terms of what's available in the market to address safety measures. You know, in some places there are products available in the market, desanitizing rugs and things like that. But definitely a number of offices that were already taking measures in terms of limiting contact, you know, putting in place measures so that social distancing is easier. For example, you know, making sure that a lunchroom that may accommodate many more people only accommodated 4 with social distancing. Again, something that was already said is limiting the use of public transport, allowing for the use of ADRA vehicles to pick people up. And one question that we spent a bit of time on was also the question of how do you actually enforce some of the things that are happening that are recommended inside the office? What happens if you know, individuals might be a little bit too relaxed, or you know, they're not following the guidelines? We had a bit of a discussion on that you know, that there's a bit of a sense of positive peer pressure, but also that may depend on your cultural context, whether or not people feel free to do that, or you know, if it's somewhere here like the United States, where not necessarily in our office, but out in public, there are a lot of people who are openly resisting, you know, guidance. And probably the final point that we spent some time on was how do we deal with the pressure either to close initially or now to reopen offices. This issue of perhaps pressure around you know, economic pressure. People need to get back to work. People need to you know, resume their activities, or and how do we deal with this type of pressure and make sure that we're making the right decision for our people? And I think part of the response to that is we need to be flexible. We need to take into account the individual situations of people, whether or not they themselves might be, you know, compromised in terms of their health, or have someone in their home that is. But overall, just a general comment, I'd like to say I was really impressed by how considerate and how well thought through it seems that the activities of all the offices have been. ADRA India even taking on additional insurance for their people to make sure that if they incur additional costs, that they have the ability to cover them. So very productive discussion in our group.
Thanks very much for that, Jason. And thank you to each one of our facilitators for your ability, you know, the ability to lead the discussion in the groups and then to feedback to the wider group. I'm just going to double check that I haven't missed any further questions in the chat box. I don't think I have.
Victoria?
So yeah, Eric.
Just one additional comment that I think it was important, was shared by ADRA Ecuador regarding what we've learned and what we accomplished because of remote working. And they presented an example of a call center that they set up to provide basic medical attention, you know, orientation on symptoms and so on, and psychosocial support. And they were able to cover with that greater areas, geographical areas, more people in a shorter time, and the staff, ADRA staff, felt more safe, protected when doing that than going door by door. And so sometimes when we think of the limitations of remote working, we actually have also a lot of potential to improve and do more with less money in less time if we are able to innovate and find new ways of doing it. I think that was a good example that I wanted to share.
Yeah.
And something else that was also mentioned that I think is important is that one of the limitations is that people do not have anymore their schedule, fixed schedule, working schedule, and that can be a challenge also. We're trying to keep our people safe and motivated and feeling well, but at the same time, if we don't help them to manage their time so that they do not, work in excess, then that's something that we definitely need to look into in this kind of context. Those two comments.
I think the balance is really important. And I know, like personally, I've worked remotely for a number of years. And so it wasn't really such a big transition for me, but for some of my other colleagues, the transition between working in an office and working remotely has been a really big thing. Obviously, when something's different, it's going to be a big change. And then, in a way, the whole COVID-19 response in many countries has been like a big emergency response. So there's always an increased workload when there's something uncertain like this happening, and it makes staff feel a lot more stressed. And I just wanted to also draw out on a comment that ADRA Solomon's made, and that was with regard to the staff being allowed to make their own gardens. Part of that, as I understood the comment, was not just for staff to grow their own food, but for staff to actually feel reassured that they were able to do something proactive and not to be stressing out about their food supply, and to, to have that opportunity. So it was like one action, but two impacts, if I understood Stephen correctly. So yeah, and so I just want to thank everybody again for your input and your willingness to share. We will have a survey that is sent out at the end of this forum. We would really love to hear from you about what you enjoyed about this forum, what you think we could improve of. We've never done anything like this before. The idea of having breakout rooms is new for us. This is the first time we've done it. And to incorporate that with multiple languages, that's also the first time we've done this. So we're really willing to try new things. So if you've got some ideas and suggestions, please, fill out the survey and let us know what we could do better next time. Let us know what we could focus on. And yeah, we really do take into consideration what people are saying. The other thing is that I'm not sure if any of you are aware, or how many of you are aware, but the Health Technical Learning Lab has a community of practice page on Facebook's Workplace. So there are a number of workplace groups, and one of those is the Health Technical Learning Lab Facebook or Workplace groups. If you're not familiar with Workplace, think Facebook. They're owned by the same company, so they're very, very similar. And if you're interested in joining that, you can contact any one of us who you've been in touch with regarding this forum, and we would love to help you get set up in the community of practice and also with Workplace. There will be a recording available for this forum, and that will be sent out to your email along with the survey link that you can click on to take the survey. And there is actually also, there has been one or two documents that have been shared in the chat message as we've been progressing through the forum. So those documents also will be those will be sent out with the email to the participants. And so I wish you all the very best. Stay safe, God bless, and yeah, we look forward to next time.
Thank